he didn't have even an ounce of fear or stress or anything in his short little life, and that he never knew a life outside of his mother. He didn't know a life outside of me. He was always just warm and comfortable, and that meant a lot to me, and I just had to focus on that in those moments. Before we dive into this episode, I want to give you a heads up that we will be talking about some deeply personal and sensitive topics, including miscarriage, infant loss, pregnancy termination, depression, and anxiety. These are heavy subjects, and it's okay if you are not in a place where you are ready to hear them right now. Your well-being is so important, and if this feels like too much for you today, maybe it's not the right time to listen. Please take care of yourself and come back when you feel ready. Hello and welcome back to It's Getting Mom in Here. I'm your host, Kori. We're going to jump right back into things. I know that this is definitely a long-awaited episode. If you've been following along with the release of each episode, you know that I took a week break. We were away with my family, and I really just wanted to give this episode some extra time because this is the big one. This is the delivery. I think there was also a part of me perhaps that was maybe not avoiding, but was just really nervous to record this episode. I would say the delivery is the part that I keep closed off the most out of everything. So there definitely was some fear of reopening and really getting into those kind of dark corners of this memory and being ready to openly share them with everyone. Thank you for your patience with me when it comes to getting this episode out. And those of you who reached out and let me know that you were looking forward to it and just following along, all of those things just mean so much to me. So if you are able to leave a review, a comment, a rating, any of those things, share this with somebody, all of those things mean so very much to me to get this podcast into the ears of people who could benefit from listening to it. So with that being said, this is just a little reminder. If you are new to this podcast and this is your first time coming across an episode, I would highly recommend that you start from the beginning of this season because I'm telling this story in sequential order. Things will make a lot more sense to you. And as always, I put a little content warning before each episode, but this one is going to be heavy. So I just want to reiterate, if you're not in a place where you feel ready to listen to this story, if you're not ready to hear about the death of a baby or the loss of a child, then just step back. Maybe this episode isn't the right one for you right now, and that's okay. I really want to emphasize that it's okay to take care and skip an episode or not listen right now. So where we had left things, I had just received the call that it was time for us to come in to the hospital. They were ready to induce me. So I had a little bit more to eat. We got all our bags packed into the car and we were on our way. We live very close to the hospital, so it was less than a 10-minute drive for us to get there. And I mentioned this before. This is a hospital I used to work at, so I'm thankful that I have a lot of comfort in coming to this hospital, that part wasn't necessarily scary or daunting to me. We're entering through the patient entrance, and this is still COVID times. This is early 2022. It's March at this point. We're getting into the hospital, and because of COVID regulations, there's a check-in, and you need to answer some screening questions. They basically just need to make sure that you actually need to be at the hospital that day and that you have, the limited number of guests or support people that you have with you. So we're standing in line. There's a bunch of different tables to check in. It's our turn. Someone waves us forward and they're asking the questions. And I have all this anxiety and overwhelm just walking up to tell that person why we're here that day. So they ask, what are you here for? What department are you going to? And I say, we're going to labor and delivery. I'm getting induced today. And I felt so uncomfortable saying that because visibly, especially in like a big winter coat, I did not look that pregnant. I had a bump, but I did not look like somebody who, was 42 weeks ready to be induced. And that was awkward for me because I was like, oh my God, what is this person thinking? Do they know why we're here? And just all those thoughts start to creep in. We're checking in. They're able to look up, yes, my name's in the system. Okay, Taylor's there with me, yada, yada. And I can just feel I have so much anxiety. I'm just buzzing at this point. There's so many emotions. And then some I don't want to be mean, but like some idiot comes in. He's in the front doors and he is a driver for a company that helps transport people who need specialized transport. So in this case, it was somebody in a wheelchair. It was an older lady who is not able to like propel this wheelchair on her own. So he's pushing her in. She's wearing a mask. He's not. He's got his mask like wrapped around his hand. And one of the attendants at one of the desks where you can check in just shouts over, "Hi, sir, you need to put your mask on." And he's standing like right in the doorway and he goes, I'm just dropping her off. I'm leaving. And they're like, okay, that's fine. But like while you're in the building, you need to have your mask on. And he's like, I'm leaving. And it's like this shouting match of these two people. You need to put your mask on. I'm leaving. Then leave. Your mask is on your wrist. Just put it on your face. And I'm standing there being like, wanting to shout back and being like, my baby's about to die and you're arguing about putting a effing mask on and all that. And it was just like, oh my God, I did not need any more heightening of emotions in this moment. And it's like, I hate that has become like a core memory of this day. And it's like so clear in my mind, this man arguing about masking. And it's like, it's not like it's 2020 and COVID rules just came out. Like we all know you need to wear a mask, especially in the hospital. And frankly, like that should have been a thing long ago, being in a hospital with sick people and all of that. This place, out of all the places to be told to put a mask on, like makes the most sense. So anyways, I was just like at my limit. And it was just such a clear moment to me of like, other people just do not care what everyone else around them is going through, and that we are going through one of the worst moments of our life. And this guy is arguing about putting on a damn mask. And it was just a clear thing to me looking around at the other people. You have no idea why people are at the hospital. And it's like, I don't know, 80% of the time, people are not there for something good. You don't go to the hospital just for fun. So anyways, that is just a memory that sticks out. We check in, we know where we're going, we head to the elevators. And again, this is now where I feel the worst feelings of like, get me out of the public and into my room, because I'm about to go to a floor of other people that are excited that their babies are going to come into the world today and then be brought home. And that was not the reality that I was living in. And I just did not want to be around people. I didn't want to be around any people that were going to experience what I wanted to have. We get to the floor, the department, the labor and delivery department. They take us to our room pretty quickly, which was good. We didn't have to wait in a waiting room for all that long. And I think a lot of that is also with COVID. They were just trying to get people out of those public spaces as quickly as they could. It was nice that I was familiar with the rooms again. So having that little tour that I had a couple days prior was really beneficial. And the room, like, honestly was gorgeous, as gorgeous as a birthing suite can be. It had massive windows. It's up on the 4th floor, and that's high enough up that you can really see just like the trees of the city. You get kind of a nice view. And there's just something like nice about being able to look outside. The room was big. We had our own washroom in it. One of the things that was hard to see in that room is the little baby warmer, the bassinets, and knowing that our son wasn't going to be placed in that for any real purpose. He wasn't going to use that for its intended purpose. And that was just kind of a hard visual to have in the room. But other than that, it was roomy, it was comfortable. We got set up, we stashed our bags, our many bags, the too many bags that we brought with us. We were able to kind of tuck into a corner out of the way. I was able to get into a gown and my robe and get under the blankets, put our blankets on, like really get cozy as you would in any delivery that you're going to the hospital. You get cozy, you set yourself up. We then are just playing the waiting game. So we had let our midwife know that we wanted her to be there the entire time because this is now my first birth experience. I'm feeling totally out of my element, especially because at this point I was just about 22 weeks and I didn't have time to go to any of the birthing classes. And ultimately, I was still going to be birthing my baby. And I had no idea how to do that. I had no idea what to expect. I didn't have time to do all the research that I would have liked to do. And my midwife really understood that. Our main midwife wasn't going to be available until around noon that day. So she sent our secondary midwife. So we were waiting for the secondary midwife to arrive, who still at this point, we had not met, but we were like, we just want to have our person in the room. And she is going to stand in and say, hi, nice to meet you. I'm your person. So we're waiting for the midwife to arrive. We're waiting for different checks with the nursing team. They're going to be, doing those standard things, checking my blood pressure and getting an IV started for me and just all of those sort of routine things. It felt like there's just a lot of waiting now. We waited and the secondary midwife arrives. We got to know her a little bit. And there was definitely moments of feeling a little uncomfortable with having her in the room and not having met her. But she just inserted herself so smoothly into the role of support. And it was nice to meet the person who had shared that initial news of the heart defect with us. Because if you remember, she was the one that called us and read the report to us about what was going on with our son's heart. So it was kind of nice to be like, oh, you're the one that called us with that bad news, and get to actually meet her because she did have a really impactful role in this journey. And it was just nice to have somebody that was in the room with us all the time that we could talk to about anything and get some questions answered. One of the things that a midwife can really help you with in any delivery is your birthing wish list, your labor and delivery wish list. So I didn't really have one. And much like the research that I had done into what to pack in a hospital bag, I found that the information around what to put on your birth list was pretty irrelevant for our situation. There's a lot of information out there that says on your wish list, don't be so tied to it that if things change, you don't want to be upset by that. And it just felt really irrelevant that it's like, well, shit, things have already changed so much. Like at this point, I don't care what happens because this is just so not going my way that you just don't care. So I put a few things down sort of mentally of what I wanted. And I had reached out to my primary midwife and let her know that really the only thing that was on my list was that I didn't want students to be a part of my experience. Having worked in the healthcare field, I was a student once. I get it. You have to learn. I am like 99% of the time, like, yes, bring a student in. A student wants to try giving me an IV or an injection. Sure. Let them give it a go. I'm so willing to have students be a part of it. I just had this gut feeling that I just didn't want to be used as a learning opportunity in that moment. I didn't want to be like, oh yeah, somebody's coming in and they're going to have a tiny little stillbirth if you want to see that. Like, I just didn't want to be that person in that moment. And I didn't want to be like the bedside learning experience for someone. It just didn't feel right. I didn't want to feel like I was maybe like put on display. It was just, I was too vulnerable to be able to do that. So that was really the only thing that was on my list. And unfortunately, I don't know that that was passed on to the secondary midwife, which is fine. I could have also spoken up and told the secondary midwife that, but I just didn't feel like I had that same level of comfort. And then it's interesting, when I'm in the hospital as a patient, I feel like my own level of like self-advocacy just plummets. Outside of the hospital, I am able to speak up and advocate and speak my mind, no problem. If I am there alongside somebody else, I am able to speak up, no problem. The moment that I am the patient, I become so quiet and like timid and I don't want to put somebody out. I don't want to ask for more work I don't want to request something that's going to, be a hassle for someone, to the point that like I couldn't even ask for my own like ginger ale or jello cup. I was too nervous to ask for it. So in those moments when suddenly a fellow, a resident, and a med student and a student midwife all walk into the room to discuss how to induce pregnancy at this point in time, I was just so nervous to speak up. And it's like, it'll be over soon enough. This moment that I'm uncomfortable with, just let it at the bedside there. I believe in this moment that I'm going to share, it was a resident and a midwifery student. I sort of in my mind was like, you're always going to have residents coming into the room. That's like, it feels a little bit different than it just being like a student or like a co-op placement or something like that. I'm like, residents are bound to come into the room. I was like, I just need to be comfortable with that. I won't be able to have a say in that. So the resident comes in with the midwifery student, and I wasn't totally comfortable with that midwifery student being in the room. But I had met her at a previous appointment. So I sort of told myself, oh, it's fine. She's sort of an exemption to this request that I had. But that was just really me just conceding with my own desires, because it was easier. It felt easier to just be quiet about it. So in my particular induction, they were using the medication. So if you remember, the night before I took the step 1 medication, and now it's step 2. And I can't remember if at this point it's misoprostol or mifepristone or whatever it is. It's one of those medications, and it needs to be inserted vaginally. So I had been told that I would get the option to insert it myself or have a healthcare provider insert it. I had already decided in my mind that I would prefer if somebody else inserted it for me, that was something that I was comfortable with. In that moment, I wasn't asked, and it would have been nice to be asked first. It just sort of felt like it was, well, this is just how we do it. If you've ever had a medication inserted into your body to anywhere other than your mouth, it's pretty personal. There needs to be some extra care in the way that it's done. And sometimes when it's a student, they're just not there yet to give that extra care. They have the medication. They tell me they're going to be inserting the pills, and then they're going to inject some saline into my vagina to help the medications dissolve. I'm like, okay, sounds good. I'm just, you tell me where my legs need to go kind of thing. Just so uncomfortable with all of this because of the emotional stress, just all of it. I'm like, just get it done with and leave the room. The student midwife is the one that's going to insert this medication. And I'm sort of in an awkward position to really be able to view what's happening. And I can feel her insert her finger. And then the resident sort of whispers, you need to put the pill on your finger first. And I'm like laying there being like, my God, did the midwife just basically like finger me without putting a medication on first? Like it was just a moment of like, this is why I didn't want a student in the room. Like this is like trauma inducing shit. I had in that moment thought like, if this had been anyone else, this would like, you could make a big stink about something like this. Like that's not okay. And I just kept brushing it off because I'm like, oh, it's an accident. She's a student. We've all been there, cut her some slack. But it was just like, oh my God, like, how did you mess that up? You have to insert medication into me. You need to have the medication on your finger. Like, what was her plan? So I don't know if she was just thinking she had to check for any like dilation first or whatever it was, but it just wasn't discussed. And from a patient care standpoint, if you make an error like that, just say to the patient that you made an error, or that you like explain to me why you did that, because I heard you say to her that she made an error anyways. It just felt like this is not how I wanted this to go. I sort of just brushed that off. They eventually get it right. They insert the medication, inject the saline. It's fine, but it hurt. And it was a moment of like, oh, I wish that I had been able to just do this myself, because she is new to inserting medications. She didn't even know she needed to put it on her finger. Then she inserted it and it caused pain. And it was just like, I want this moment to be done. Finally, it was done. They left the room, whatever. And I don't even speak up about not enjoying that experience. I'm so out of my element. I'm so uncomfortable with everything that it's just like, I want to just sit and put something on the tablet to watch, talk to the midwife, talk to my husband, just get my head out of this moment. I'm going to fast forward a little bit. There would have been a lot of in and outs with different people and the waiting for the medication to take action, which I'm just going to kind of blow past that. Skip ahead to when my regular midwife came, because that is definitely when the vibe changed. So my secondary midwife left, and it was really lovely getting to meet her and build that relationship. And I think had we been able to do that sooner in the journey, I would have felt a little bit differently about having her there and being comfortable speaking up to her. And it's really like, it's no fault of her own. It's just like how the timeline went. And she honestly did an amazing job at just stepping into the role, because I'm sure she also has her own experience of like, yeah, it's hard to go into a room when you've never met the person who's about to give birth and their family and they're about to lose their baby. Like, from her perspective, that's a tough situation to walk into and try and match the vibe. And she was really lovely too. She said, she was like, I'll just keep talking this whole time. And if you don't want conversation, you tell me and then we'll have quiet. But she was happy to just bring things up to talk about. And she did do a really great job at stepping into that role, but I definitely was feeling a lot more comfort when my regular midwife came in. She comes in, she relieves the secondary midwife, and it's just like, okay, she's here. My midwife just has this way of bringing in a sense of like leadership and confidence alongside like friendship and care. It's like a really wonderful balance that she's got, that I just felt like the room was like more balanced and at peace. And she brought in those things that I couldn't bring in those moments. She was now going to be the one to advocate for me. She wasn't there for long, and in comes the resident and that midwife again to check up on me. And it was like every time they came into the room asking like, how are you doing? And it's like, well, how do you think I'm doing? This is awful. I hate all of this. It was just like, just leave those pleasantries out, because they're useless at this point. And I'm just going to lie and say, oh, I'm good. So they come in, they're asking some different questions, and then they leave. And my midwife looks at me and she goes like right away, I thought you said you didn't want any students in here. And I was like, yeah, like I'd prefer not to. And she's like, I'm on it. Gets up, walks out of the room. She doesn't even give a chance for no negotiation of it. She's like, you did not want this. I'm going to go handle it. And she goes out into the room. She handles it. She comes back in. All good. No more students. And it was like, I didn't even have to worry about it. I didn't have to deal with the awkward conversations of saying, I don't want this. She was like, bam, I'm here for you. You told me you don't want this. I'm going to go correct it. And it wasn't until much later in a conversation with my midwife that she told me that, I'm laughing, but it does hurt my heart a little bit, that she went out and she said, no more students, please. The mother has requested it. And the student midwife started crying and thought that she had done something wrong. And my midwife was like, no, it nothing to do with you. It was a request she had prior to coming in, and it just, it slipped through the cracks. It wasn't mentioned. And so just from this point forward, no students. And then that was it. So I'm glad she didn't tell me in that moment that it made somebody cry, but it was a really hard thing for me to say no students. And so it was so wonderful to have somebody else do that for me. So most of the day at this point is just some in and out of the nurses checking my vitals and the nurses just doing their nursing things. At one point prior to actually coming in for the induction, I had been told that I would have a heart monitor on me, like on the baby. And I brought it up to my midwife and said, why would I need that? Like, we know that the intent is for the baby to pass. So why would we be monitoring the heart rate? It's not going to change any of the interventions. And she was sort of like, yeah, that's odd. Like, I don't know why you would need that. And I said, I actually don't want it. I knew that my son was going to pass, and I had been told that there was roughly a 50-50 chance of him being born alive. I didn't want to know when he passed. I didn't want to know when I was delivering. If he passed before he was born, I didn't want to know when that moment happened, because I just didn't want to know. I didn't want to know when that moment happened. So I didn't want to have a heart monitor on. So thankfully, they didn't need to do that. We got at one point a visit from the MFM, which was great, kind of in between cases. He came in to say hello, and we were just like so thrilled to see him. He just brings such a warm, calming presence to any room. And it was just like okay, I have my midwife, I have my MFM, I have my husband, all my people are here. These are my people in this moment. So it was really comforting to see him, and he let me know that he is going to do his best to be there for the delivery, but he's covering everyone on the floor, and it could potentially be a fellow that delivers the baby, but he was going to do his best to be the one to actually be there and delivering. So that gave us a bit of time to mentally prepare, like, okay, it might not be him that actually does the delivery, but he will be here. He's around. We just got to get this baby out before 7 a.m. the next morning. Now, every like 4 hours or so, someone would come in, they would insert more of the medication. And this medication, it works very quick. And contractions were starting to happen, and upset stomachs were starting to happen, like all those really typical symptoms of labor were starting to happen. And one of the cruel things in your body is, regardless of how big or small the baby is, the contractions feel the same. So I was starting to feel some feelings, and I got a lot of back labor. I was feeling the pain, and I had such a low threshold for the pain also. I had no interest in fighting through the pain. I had told myself very early on that I'm going through enough emotional pain. I don't have to also bear through physical pain. So I knew I was going to be like, yep, give me all the drugs. And so as soon as I started feeling the pain and was starting to feel uncomfortable, I was like, all right, now's the time. Let's get this epidural going. They were lovely and very quick. And I don't know if it's that like you get some special treatment when you're in those bereavement rooms or whatever the deal is, but the anesthesiologist came very quickly and was able to do the epidural pretty much right away. I didn't have to wait very long from the point of asking for it to receiving it. If you've ever had an epidural before, you've seen somebody get one. They put the needle in, they get the medications flowing, and then they have you lie on one side and roll to the other side to really just evenly distribute the medication to each leg, each side of the body. I was turned on to one of my sides and I wasn't feeling it yet. And so they did an additional bolus injection on top of the drip. They were really pumping up the meds. And I'm laying on my side. And at this point in the day too, we've been at the hospital for a few hours. So I'm starting to just feel more comfortable in the environment. And like I said, now with Taylor and my regular midwife there, I'm feeling more comfortable. And I'm a chatty person. If I stop talking or get quiet, that's when you know something's wrong. And I got real quiet. My face started to go quite white. And I said, oh, I'm feeling nauseous, which is not abnormal when you're going through labor. It's not uncommon to feel nauseated and to vomit. So I'm lying on my side. They put a towel on my head, like a cold cloth. They give me a little vomit basin, which I did not vomit. So as I'm talking about this, if you're like grossed out by vomit, I didn't vomit. So I'm not going to talk anymore about that. But I was just feeling so nauseated, and they were very quick to give me some, like an injection of Gravol to try and combat that. And I could feel myself just like drifting off, getting really sleepy and just wanting to close my eyes. Things were getting a little bit hazy, and I could hear the nurse make a phone call to get the anesthesiologist to come to our room stat. And I'm like, out of it, but I hear this and I'm like, that's not good. That's not a good call to hear. And I'm kind of like clueless to what's going on. So my blood pressure was dropping drastically after getting the epidural, but I was starting to feel good in terms of pain relief, but the nausea was bad. But at that point, I'm like, I will take the nausea over the pain. So when I'm hearing this, I'm like, oh my God, am I one of those people that has a reaction to the epidural? Are they going to have to take it out? Like, that was my biggest fear, that it was like, please don't take this epidural out. Meanwhile, my blood pressure had dropped to like 90 over 60 or something. It was quite low. Potentially even lower than that. But anyways, it was low enough that they were like, we need to do something about this. So the anesthesiologist comes in and he pulls the catheter in my back out an inch or so, and just to see if it was a placement issue, which indeed it was a placement issue. And very soon after that, my blood pressure starts going up and I start feeling better. And it was just such this wild thing to be like, holy shit, like your blood pressure matters for how you feel. As soon as it went back up, I was feeling good as gold. So we were in this sweet spot where I had a really nice epidural. My legs weren't completely dead weight, and any of the little pains that I still sort of had in my hips and uterus area, my midwife was able to heat up a saline bag for me and have that as sort of like a warm compress on me. And so I was comfortable at this point, and it just was like, okay, a bit of a reset. We're going to wait for whatever comes next. Every couple hours, like I said, I was getting additional doses of the medication inserted into me. And after having the epidural, it was great because it was pain-free. I couldn't feel it. I could care less. Yep, whoever, stick your finger up there, put some medication in. Let's get her going. And it's getting late now. Late as in like 7 p.m., 8 p.m. And my midwife says, okay, why don't you just have some rest? It's been a long day. I know you didn't get a great sleep yesterday. Just have a bit of a rest. So we like to joke because right before this happened, Taylor, he's having his snacks, he's doing his thing, and he had just had like a bottle of Coke. So he's like hopped up on caffeine from Coke and is like, all right, I guess I'm going to nap now. We turn down the lights and I ask my midwife, can you please stay in the room? Because I could feel my nerves going up and up and up. I had been told after the most recent dose of the medication that I was looking good in terms of dilation. And because of how small the baby was, I wouldn't need to go to 10 centimeters. So they were like, things will happen fast once they start happening. And they told me, once you start feeling pressure, let us know. And I'm like, but I can't really feel anything. What do you mean I'm going to feel pressure? What do you mean? Tell me. And this just adds to those nerves that I had of feeling so unprepared for everything. So I was feeling a lot of anxiety. So I asked my midwife, while we're napping, could you just stay in the room? And she was like, yep, I'll do that. And I just was like, I just need somebody right there. I just need my person right there. And in those moments, she was my person. So she just sat, she's, scrolling on her phone, doing whatever. And Taylor and I are trying to rest. And I have just sort of drifted off. I maybe fell asleep for like 20 minutes or so. And I hear my body make this sort of trumpet-like sound. And I can feel where that trumpet-like sound came from, if you catch my drift. And I open my eyes and my midwife goes, are you feeling pressure? And I'm like, I think so. And so she comes over and she checks and she's like, oh, yep, it's time. It's time. I can feel that it's time. So we wake up Taylor and I'm like panic mode. I'm so glad that she's there. Like my midwife is there to be able to be like right away checking things and confirming things. I think I would have been really nervous had that happened without somebody right in the room with me. So she goes out, flags down whoever she needs to flag down. At this point, I'm like, I really hope it's my MFM because I think that I'm about to deliver this baby. So she comes back into the room and she said, okay, the doctor will be here soon. We're going to get you onto your back. And I'm like, oh my God, this is it. All these emotions, like I'm buzzing with feelings. I'm feeling excited because I'm about to meet my son for the first time. I'm going to see him, but I'm feeling terrified because this is it. This is the big moment. This is what we had been waiting for. Every emotion was there. And then like fear of what my body's about to go through. So the door opens and in comes the person who's about to deliver the baby. And with the biggest sigh of relief, it's the MFM. He's here. Our person is going to be delivering my son. All is right in this room. It just felt right. I can feel myself in this sort of panic mode that things are getting heightened. The nurses in the room, they're checking this and that with me. Everybody's kind of getting into position, like it's the big show, here we go. The MFM gets me into sort of a good position to start pushing. I'm already tearing up because I'm so scared to push. It feels like this is the last step, that this is the last thing that I have to do. I have to push. Let me sort of set the scene here. So it's about 9 p.m. in March. The room is dark. The room is calm. There's only the soft beeping of the machines around me. My husband is by my side. My midwife is right there over the shoulder of the MFM. The MFM is down at the bottom of the bed. And he explains to me, okay, it's time. When you're ready, you're going to push. And I was like, I don't know how, I don't know what to do. And he's like, just breathe and you can push. And it felt like in that moment, it was like I had this like tunnel vision of me and my MFM. And it was like, let's do this. I have my support around me, but I just felt like I was so focused in on the calmness in his voice, the peace in his voice. And that's what I needed in that moment. It was just this beautiful, beautiful moment. It was just a serene environment. And so I started pushing, and then I pushed again. And then our son was born. He did not take too much work to birth because he was so little. The MFM caught him and placed him on my stomach. Because the umbilical cord was still so short, that was as far up as he could make it. So he just laid him on my stomach. And I can remember my hands shaking, almost not knowing what to do, not knowing how to hold him. This moment of, oh my gosh, my son is here. And in that same moment, knowing that my son is gone. As soon as he was born, I looked at the MFM and I asked, is he alive? And he just shook his head no. And that was so heartbreaking in that moment, but also this relief that I knew that he passed while he was inside of me. And that was the most comfortable, peaceful place for him to pass, that he was cradled inside of me until the moment that he passed. And there was just something so beautiful about that. But also this part of me that just longed to see my son take any sort of breath, to see him move even a little bit. It was just like something of a lose-lose situation, and just trying to find that comfort in the fact that he didn't have even an ounce of fear or stress or anything in his short little life, and that he never knew a life outside of his mother. He didn't know a life outside of me. He was always just warm and comfortable, and that meant a lot to me, and I just had to focus on that in those moments. So this is obviously the stuff that's really hard to talk about, and even a little bit harder than I thought it would be. I didn't expect to cry like this, and I know that if I stepped away right now, I could go either way of like, okay, go bawl your eyes out or go clean the kitchen with this anxious energy that you've got. I think there was something really beautiful about that moment and that peace in that moment, and the way that my MFM just shook his head. And it was like, it felt like he grasped the pain in that moment and in asking that question, and that like this was not just another day at work for him. He was grieving in that moment with us, and he knew that That was a hard question for me to ask him, and I knew that was a hard question for him to have to be the one to answer. It was really sweet. They did everything like you would in any delivery. It was really beautiful. Ooh, I think I need to take a sec so I'm not sniffling through the rest of this. They did everything like they would in a delivery of a live birth. They clamped the cord, and my husband was able to cut the cord. They cleaned him up and they wrapped him in a blanket, and they were able to now bring him up to my chest. I still had to push the placenta out, which honestly was the harder part of it because my placenta was still very much intact, and they really had to push. I really had to push. They really had to push on my stomach to kind of like detach it, and I was very relieved when that part was done because now my work was over and they could start, taking down the epidural and started to set me up for what comes next. So I think this is a good time to pause this episode. I think that the birth experience is a little bit of a two-parter. So part one is actually the birth, and then part two will be the time that we spent in the hospital with Stanley. And if I'm honest, I need a break from recording because this is really heavy and it feels like a moment of like, I think I need to call my therapist. We still have some stuff we need to work through. So we're going to leave it there. I hope that you will tune in to the next episode where we talk about what it was like in the hospital with our son for the moments that we were able to have with him after he had passed. And this was a really special episode and something extremely personal to share. And so if you took the time to listen to it, thank you so much. I think that there's so much value in sharing a birth experience such as this one. And I hope that it sort of entertained some of your curiosities of what it might be like for somebody who goes through an experience like this. As much as I said I didn't want to be the subject to a student in that moment of delivery, I think that at this point I am happy to share my story and for people to learn from it and be educated. And so this is sort of like my opportunity to give that back. So I hope that you've enjoyed this. And please remember that if you have any questions about anything that I've talked about, you can head to my website, itsgettingmominhere.com/about the show. I have a little question box where it's up to you if you want to leave your name or if you want to remain anonymous, and we will read out those questions in a bonus episode. So if you have any questions, you can head to the website. I will link it in the show notes. And as for that, that's it for today. Thank you so much for listening, and we'll see you next time.